From KGW News, this is Straight Talk with Laurel Porter.
Hello and welcome to Straight Talk. I'm Laurel Porter. You've heard a lot about what went wrong with Measure 110, the voter-approved measure that legalized possession of small amounts of drugs. It promised to focus on getting help for people with substance abuse issues, but there weren't enough treatment options available, and a lot of people became unhappy with the open drug use they were seeing on the streets of Portland. The Oregon legislature reversed course earlier this year with House Bill 4002 and returned criminal penalties for public possession and use. But there were also some positive outcomes from Measure 110, and there are good things happening in our community right now with organizations trying to get people the help they need. We're pleased to have with us some of the folks who are on the ground dealing with the addiction issue, some who have lived experience and initially advocated for Measure 110. Let me tell you a little bit about our guests. Janie Gullikson is the executive director of the nonprofit Mental Health and Addiction Association of Oregon. She is a woman in long-term recovery and has personal lived experience of mental health and addiction issues, homelessness, and incarceration. Janie has turned her life around and leads one of the state's largest peer-run agencies that provides support to people seeking hope, health care, housing, and healing. She was one of the co-sponsors of the original voter-led initiative that eventually became Measure 110. John Karp Evans is the Senior Director of Downtown Portland's Behavioral Health Resource Center. Drawing from his own experiences of formerly being justice involved and now in long-term recovery from substance abuse, John brings a unique perspective to his work. He has been instrumental in developing and enhancing housing programs while integrating culturally specific services guided by his personal journey. John was named a hometown hero during halftime of a recent Portland Trailblazers game. Also joining us, Officer David Baer, who leads the Central City Bike Patrol. He was instrumental in the creation of the partnership between the police and service providers to have on-call peers available during interactions with drug users to encourage them to accept treatment options instead of a ticket or jail. That program, which ran weekly since mid-December 2023, has recently been fully funded jointly by the City of Portland, Multnomah County, and the state of Oregon for the next 12 months. Welcome to my guests, Officer David Baer, John Karp Evans, and Janie Gullikson. Welcome to Straight Talk. It's so nice to have you all here.
Thanks for having us.
Thank you.
Yeah, well, you all work directly with people on the street. You see this firsthand. So describe for us what the situation is right now on the streets. Let's start with Janie.
Thanks, Laurel. I think we're seeing a level of challenges that we've not seen before, and that could be for many factors. But I think it's complex and going to take all hands on deck approach to work towards solutions. And I think, you know, folks who we see on the streets who are suffering could use a source of support and hope, and that's what we hope to bring them. Yeah.
John, what are you seeing?
Yeah, specifically in the downtown core, we're really seeing a resurgence of people coming back to see what folks haven't seen for the last several years. Since downtown's been fairly empty, now that we have people rejoining the area, we see the highlight of substance abuse with lack of services in our community. They've really had this perfect or not perfect storm, I guess, for what folks want to see in the downtown core.
And Officer Baer, what are you seeing out there?
You know, right now we are hopeful going into the summer that, you know, the worst of downtown Portland is behind us in terms of the drug crisis, and we're very grateful to have these partners here, you know, and this program going forward to hopefully turn things around.
Well, let's find out a little bit about what your organizations do. So let's start with Janie, and you are the executive director of the Mental Health and Addiction Association of Oregon, or MHAAO as an acronym. So tell us a little bit about what you do.
Yes, so MHAAO is almost 200 staff of people with lived experience offering support services in a non-clinical way, using their lived experience to those who may be seeking care, and that care could mean, you know, connection to treatment, substance use disorder services, mental health services, housing, community resources like food and shelter as well. And so MHAAO offers those supports in a direct way, as well as we train the peer workforce. The work is done by peer support specialists, and so they need training and support. And then we have the day center downtown that serves folks living outside primarily, and connections to care. And so anything peer support services from that lens of lived experience, we're doing it.
So MHAAO runs the Behavioral Health Resource Center downtown?
The day center portion, floors
Okay.
1 and 2.
And so you, John, are the Senior Director of the Behavioral Health Resource Center, or BHRC. That's the acronym. Tell us what you do.
Yeah, so the BHRC is a peer-developed, peer-run day center in downtown core, where we have a staff of all individuals with lived experience supporting some of our most vulnerable people in our community on a daily basis, from basic needs like shower, laundry, computer service, all the way to linkage to clinical services like mental health care, substance abuse, and detox.
We're going to talk a little bit later about all the statistics that show, how successful both of your organizations have been. Officer Baer, you lead the Central City Bike Patrol. Tell us about the partnership between you and the police department and the partners like Janie and John's organizations, and how you connect with people. How does it work?
Yeah, so I am on the Central Precinct Bike Squad through the Neighborhood Response Team, so we're called the Central NRT Bike Squad. There's 4 of us currently, and our supervisor. And so we, when Measure 110 rolled out, we were kind of on the front lines of issuing tickets and providing the treatment card. And so we met Janie and Tara Hurst through the Oregon Attorney General Rosenblum's fentanyl conference at OHSU last November. And we wanted more options to provide to people than just giving them this card. So we're very fortunate that this partnership has grown to what it is today.
We're going to find out more about how it works in just a little bit. But I talked about earlier at the top of the show that you both have lived experience. You have quite the journeys, and that your organizations depend on peer support. So let's find out about your personal journeys. And Janie, I understand you started drinking at a very young age. You eventually got into meth, and you ended up at one point in jail. Tell us a little bit about your journey and how you ended up in recovery.
Sure, thanks. So as you mentioned, started at a very young age drinking, and that journey led me down the road of 22 years of addiction, ending up with some severe mental health challenges, chronic homelessness myself, not able to parent my children, and had lost everything. And so I was part of that cycle of incarceration, hospitalization, homelessness, and for many years I was seeking help that wasn't available to me. But eventually I was connected to a long-term treatment program made available to me in prison. And so that 6-month program was able to help me change my life. And so I've been in long-term recovery for almost 16 years, and through that have been able to, reunite with my children, be a grandmother of 19 grandchildren.
That's amazing.
And lead the nonprofit organization MHAAO, and a master's degree, things like that. So
you got your master's degree from PSU, right?
Yes.
Well, that is quite a story. Congratulations on your many years of recovery and leading such an incredible organization. And John, you have a remarkable story as well. So tell us, how low did things get for you, and how did you turn things around and get into recovery?
Yeah, so for me, I ended up at a young age mentally, physically, spiritually bankrupt, and at a spot where I felt like I had nowhere else to go due to the substance abuse. And Clackamas County supported me through the criminal justice system. And I had the opportunity at 17 years old to go to my 3rd residential treatment facility, and not to get into recovery, but to get out of a consequence. And what ended up happening was I caught this bug for recovery and ended up staying involved. And for me, it was a life-changing opportunity, and it's really propelled me in the work I do to help me provide that opportunity for individuals that may not have it. Since then, I've ended up starting a career in peer support, and then moved my way through a supervisor to a manager and to a senior director, and now have the opportunity to share my recovery. I've been clean since 11/20/2002. Majority of my life, and definitely most of my adult life since I was a minor when I ended up getting into recovery.
Well, so impressive, and I'm sure you really offer a lot to the people that you help. Both of your organizations really rely on peer support, and I imagine in your organization with 200 other peer supporters, they all have really unbelievable, incredible stories like yours, Janie. How does the approach that you use, using peer support and connecting with the people that Officer Baer comes in contact with, how is that different than the traditional approach?
Oh, That's a great question, and it's there's just something in that connection when you approach someone and start out with, I've been there in a similar way. And you don't even have to go into your whole journey of addiction and recovery, but just by saying that, whether that's, I've been without a home, I've lived on the streets, or I've been incarcerated or in the hospital, that instant connection is made. And so many times I've seen folks lift their heads and just the relief on their face that somebody gets it, and there's an instant just willingness to talk to us in many cases. And so I think, no change is possible without hope, and that's really what peer support offers, is that because we've been there and also have seen, recovery and what is possible in recovery, we can share that through that offering
Your
of peer
lived
support.
experience, and that opens the doors.
Thank you.
Officer Bear, you helped establish this partnership between Central City Bike Patrol and these organizations and offering peer support. And you started a trial in mid-December that has now been fully funded. That's right. What did you learn from that trial period, and how successful has it been?
I learned a lot. We started this project because we had to do something. What we were doing under Measure 110 with the tickets and the treatment card, it just wasn't working. And so we were willing to work with anybody. And the first people to approach us was Tara and Jeannie, and we had coffee at the Society Hotel. And they asked me like, hey, what do you need? And I'm like, my team needs social workers or peer support or anybody. Where when I find someone using drugs on the sidewalk and I ask, hey, do you want to talk to someone about, getting help or getting out of this, or just talk to somebody, and they say yes, within 10 minutes we have to have someone there, because we found in our experience that after 10 minutes people lose interest, right? The fentanyl is so powerful and so addictive. It's unlike, the traditional, crystal meth heroin that I think people still focus on. Fentanyl is so much more invasive than that it was in-person, immediate help. And so they were like, yeah, great, when do you want to do it? And I went, maybe in 2 weeks, and because of Governor Kotek, we have Oregon State Police troopers with us for, extra manpower. And so we put out all these bike officers in downtown. And so because of that, hey, do you want to talk to someone? Yep. And I could call John or I could call Janie, and they have this giant conference room full of people who are experts in navigating these very complex systems of care, and also are able to connect with people. And they would show up, and being a cop in downtown Portland, I was like, oh man, I don't know how this is going to go. And it's been going so well to the point now I'm like, things are going great. To the point, it's worked out. We are fully funded at this point, and so we're hoping to move this, hopefully citywide and expand. But so far, this has been a career highlight for me.
Well, that is so great to hear, and that offers so much hope. And you were looking at some statistics, and just to go over some of the folks listen on a podcast, that you've had 145 total encounters with peer teams, an average of 17 per day, 1 and 2 successfully connected. And we also have a map that shows where some of these interactions have happened. Where do most of them happen that you're dealing with, Officer?
So my team, primarily because we're at Central Precinct, we are a downtown-only bike unit. So, it is downtown. Currently with the way fentanyl is, we're spread all across downtown, all the way from the Pearl to Old Town, all the way up the hill. These drug markets that we're seeing, they move around, and we move our operations move with them. Right now the park blocks up by the Art Museum, into Goose Hollow. Their folks are great. They're really flexible. We've had people. It was yesterday. I called them even before we started and was like, I need some folks out here right now. Into Old Town, and he was just like, I could hear him on the phone in the conference room, like, Bear's got someone, just go. So, there's been a couple mad dashes to get people there, but it's been great.
Well, that's impressive that you can get peer support groups there so fast, and you've had so much success at the Behavioral Health Resource Center. We have some statistics that you all provided, and again, if you're watching at home, you can look at some of these statistics on your screen, and I'll tell you just a couple of the highlights for people listening. Total participants served since you opened in 2022, over 45,000. And this was interesting. Number of shower services per day, average is 52. Number of laundry services per day, 21. And this is also incredible. Lives saved since opening through Narcan administration, at least 41 lives. That was through December. So it looks like you've had a lot of success, John, but what do you see as a true measure of success?
Yeah, I think just that peer connection, right? saying someone's name, recognizing someone's face, really having someone come somewhere where they feel accepted and wanted. And what we've seen is we've seen that relationship grow, where folks might walk by a day or two and then all of a sudden say hi, and then come in the door, and then take a shower, and then say, hey, I'm interested in detox. Now that I know you and we have this rapport, can you help me get connected to these clinical services? And so success for me is really building that relationship, because it helps support individuals in our community feeling comfortable when they're ready and willing to accept help.
What is it like on a day-to-day basis when you're in the war room? You were just talking about a story yesterday between the two of you and trying to set up your day.
Yeah, I mean, I think the very first thing to realize is that there's tons of community partners, right? So there's multiple agencies, from city agencies, other nonprofit agencies, and so we have the luxury of being up here, but it's really it's a community effort. And the excitement is that every day we're seeing more and more community organizations, city organizations really come in and want to be a part of this, because we're providing instant access. And what we've realized is that there's a narrative in our community of folks don't want help, and I'm not going to say there aren't some that don't, but the real story is that it's hard to get help. And so when we've been able to offer help in the moment, we've seen tons of individuals accept it. And so working with Officer Bear's team, working with our other community partners, working with our detox facilities, when we can say, hey, we have a spot for you for detox right now, we see that willingness versus saying, hey, come back in a week or two when we might be able to support you.
And Janie, you were part of a group, an Oregon delegation that went to Portugal last fall, and you wanted to check out how their decriminalization program worked. They started way back in 2001. It inspired Measure 110. You were a co-chief petitioner on that. What was your takeaway from that visit to Portugal?
Oh, well, the biggest takeaway was that it took them 8 years from first implementing the new law to really seeing the outcomes they were hoping to see. That's a chunk of time that I think Measure 110 hasn't, for a myriad of reasons, been able to have. And there are also things that have worked well that we've seen with the funding per se. We wouldn't have been able to launch the pilot in the timeline that we did if it weren't for those Measure 110 services that were already funded. But the Portugal trip was very eye-opening, and I saw how organized and community involved the effort was before the law changed, and I thought that was also very impressive.
And John, you said that some other good things came out of Measure 110. What have you seen?
Yeah, I think we've seen this collaboration, right? We've seen tons of peers from multiple different agencies be able to really have this more open area to support people, right? Like when we bring in these pilot days, we're having individuals that are 110 funded from agencies all over our county come and support individuals in our community.
Well, I guess it's time for us to take a break. But when we come back, tackling the addiction and homeless crisis is a daunting challenge. What keeps our guests going? And what can we as a community be doing better? We'll answer those questions after the break. We're back in 2 minutes. Welcome back to Straight Talk. I'm Laurel Porter. We're talking about the addiction crisis on Portland streets post Measure 110 with our guests who are on the ground, connecting with people, building trust, and trying to get them the help they need. Welcome once again to my guest, Janie Gullikson, the Executive Director of the Mental Health and Addiction Association of Oregon, John Karp Evans, the Senior Director of the Behavioral Health Resource Center in downtown Portland, and Officer David Bear, who leads the Central City Bike Patrol. Thanks again for being here. It's just been a fascinating conversation. I understand, John, you've gotten a lot of international media inquiries wondering what's going on here with the drug crisis, the fentanyl crisis from places like South Korea and Norway. What do they want to know, and what are you telling them?
Yeah, it's been interesting. Everyone wants to know about 110 and why it worked or didn't work, in our opinion. So the main focus has been 110, but it's been really exciting because several of them came on pilot days. And so they've really got to capture challenges with 110, but also the hope. And so when individuals have been able to capture and spend a day or sometimes 2 days with us and really see this pilot program in action, they've been able to see hope in our community, even with the failure or not success of 110.
When you talk about pilot days, you mean working with Officer Bear?
Yeah, working with Officer Bear. Yeah, when we work with Officer Bear, so individuals get to see that, hey, there are folks in our community getting help. There are folks that are making a difference, and there is hope for Portland. It might not be at the speed people want or look how people want, but there are things that are happening that are positive in our community.
They're going in the right direction, you think. Well, it may seem just daunting to a lot of people to think about the work that you all do, working with people who are addicted on the streets, people who are homeless. What keeps you going, Janie?
Well, I know recovery is possible. I've lived it. and I've also been there, done that on the struggling with addiction side, as well as what I've seen as a peer support specialist myself and growing peer support programs. And what keeps me going right now is day one of the pilot, December 13th. We connected with an individual that was as a result of a call from Officer Bear and his team, who said they wanted help. And I went with the peer support specialist who made that connection, instant connection with him. And off to detox we went, and the plan was made for what would happen next for him, which, you know, you always have your fingers crossed and hope that that's what's going to happen. And he still comes back every day to visit, and I've seen him in the community, and he's stayed connected and is very grateful for the pathway to healing. Yeah.
So what keeps you going, Officer Bear?
You know, this probably doesn't sound great, but it's because I don't have a choice, right? We're out there every day. You know, if we can either do something to make things better, because what we were doing of just, you know, going out with just citations only wasn't working. So, you know, we've Narcaned so many people. We Narcaned one guy, like, you know, I've Narcaned the same guy 3 times. So being able to now hopefully provide that person a way out of their addiction by working with these folks and like their totally infectious energy is what keeps us going, because we know that if we just keep going and, you know, keep contacting folks and keep referring them, that like hopefully eventually even the ones that are, you know, more resistant eventually accept help from the peers.
How about you, John? What keeps you going?
Being able to provide an opportunity for our community. You know, I live in Portland. I've been here my whole life, and I want to see things look different. But without providing an opportunity, it's very hard for me to expect people to change. And so being able to be on the street at a ground level and provide an opportunity for individuals to change their life.
Janie, what do you think we could be doing better as a community to help build support and understanding, make your job easier?
If we could create a system where anyone, any time of day or night, seeking help could get that help and connection to care, then I think we would be doing well. So.
And what can we do to make your job easier, do you think, as a community, Officer Bear?
You know, kind of the same thing. You know, we get calls from night shift officers, and, you know, they ask me, like, hey, do you have your outreach? Are your outreach folks out? I'm like, no, I don't have outreach folks out at 2 o'clock in the morning. What we need is the 24/7, you know, always open stabilization, you know, whatever kind of you want to call it. But we need a center where we can take folks where there's always going to be that you know, open door available for them for that off ramp from the streets.
So something like a sobering center?
Yeah, whatever you want to call it, but it needs to be open all the time, or anyone in the county can drive someone there. That, because, you know, sometimes, you know, when these folks aren't available, and someone was like, you know what, I do want help. In that moment, I don't have anything to offer them.
Well, let's go around the table and kind of get your closing thoughts to leave our viewers with. Let's start with Janie. You have about 30 to 45 seconds.
Yeah, thanks. Recovery happens in community, and I believe our system can recover as well. And so that all starts with hope, and I think through what we've seen with peer support, the collaborations, the community partnerships, we're getting there.
And Officer Bear, what would you like to leave with viewers about where we are and where we're going?
You know, with downtown, we hope that the worst is behind us. Some of those like major open air drug markets, we hope that, you know, those are of the summer's past. Going forward, my team, you know, with our partners at the Oregon State Police and at the U.S. Attorney's Office, you know, targeting those people that are bringing drugs into our community, you know, with using our limited resources to focus on drug dealers versus people that are suffering from drug addiction. And that's why we're really hopeful that this project continues with these folks.
And John, you have about 45 seconds to take us to the end here with a final thought of hope.
Thank you. Yeah, I would say, one, we're changing the narrative. We had an individual that was using substances flag down Officer Bear and asked, do you have the people with you that can help me? And so we have people flagging down officers in our community asking for help.
So the word's getting out.
So
help's available.
We're changing the narrative. And this isn't an overnight challenge, right? Portland didn't just wake up like this one day. This is a challenge that's been years in the making. And so it's not going to be solved overnight. So the more we break down silos, the more we work together with government agencies, nonprofit, law enforcement, first responders, the more success we're seeing in our community.
Well, thank you so much for bringing your story to us and offering hope. And I want to give people some resources if they want help. If you or someone you know needs help, or you just want more information, point your camera at the QR code you see on your screen right now, and it will take you to a link for the Mental Health and Addiction Association of Oregon website. We also have information here for another service provider, the Oregon Hope Line, and you can see that phone number there. I want to thank our guests once again, Janie Gullickson, John Carp Evans, and Officer David Baer. And thank you for watching and listening to our podcast. We'll see you next week for Straight Talk. Have a great week.